My name is Dr. Mark Colvin. Today I'm going to be talking to you about depression. As we manage physical illnesses better and better, mental health problems, and depression in particular, are rapidly becoming the leading cause of lost working hours in the developed and the developing world. Depression knows no social class, gender or race boundaries and can affect anybody at any stage of their lives. However, it does tend to be more common among women, with an estimated 1 in 5 women experiencing depression at some stage every year in South Africa. Before we go further, it is very important to distinguish normal or reactive depression in response to a negative life event such as a death or retrenchment from the pathological depression, from which there is often no obvious trigger. Although depression is seldom fatal, only a small minority of people with depression commit suicide, it can have major impacts on an individual's life and social and working life for years and decades. It is also important to acknowledge that a key obstacle to people seeking help for their depression is the stigma associated with it. It is similar to HIV in this respect. A common response from society towards people with depression is that they need to pull themselves together. It is often seen as self-inflicted or as a weakness rather than as a genuine illness. This lack of acceptance and judgmental approach to the problem is widespread in our communities and needs to be overcome. But if we say depression is a disease, then what is causing it? Well, we don't know exactly why some people become depressed and others do not, but the underlying problem is an imbalance in what are called neurotransmitters. These are chemicals that transmit a nerve impulse from one nerve to another. If there's too little or too much of the neurotransmitter, or if it is not removed from between the nerve endings quickly enough, mental disease is often the result. This understanding of the underlying mechanism causing depression has led to the development of specific medications. There are now a variety of drugs available to treat depression. When the appropriate drugs are used in conjunction with psychological support, over 80% of people with depression will have substantial improvement in their symptoms and are likely to be able to function normally. So what are the symptoms of depression? Well, it affects different people in different ways. Some people may present with predominantly physical symptoms that don't respond to treatment. Others complain of a variety of symptoms, including feeling low mood or feelings of sadness, increased irritability or anxiety, feelings of nervousness. People's sexual libido decreases, and implications of the workplace that people have problems thinking or concentrating or remembering difficult tasks. Symptoms of anxiety are also often commonly experienced by people with depression. Things like nausea, dizziness, breathlessness, heart palpitations, feeling worried and fearful, feeling tremulous are all symptoms of anxiety that people with depression may demonstrate. So how is depression diagnosed and managed within our workplace program? Well, because of the stigma associated with mental illness, one of the first things to do is to educate the workforce and management about these conditions. People need to know the basic facts about the range of mental illnesses around and how they can be managed. When there is greater empathy for these conditions, employees will be more at ease to acknowledge their problems and seek help. We will be able to detect employees who have symptoms of depression on our questionnaire. In addition, employees will be encouraged to self-refer to company health services. So in summary, while it is true that mental illnesses will become a more important threat to individuals and organizations, if the conditions are conducive within a company, many mental illnesses may be prevented or managed effectively if they occur. This has direct benefits for the individual and the company.